All right, in health news today, Dr. Mike Romaine, an internist from the Austin Diagnostic Clinic, joins us today to talk about antibiotics because they're not always the best option to treat an illness. Thanks for joining us this morning.
Well, thank you for having me.
Let's talk about the definition of antibiotics and how they help illnesses.
Antibiotics were designed to treat bacterial illnesses. They either stop bacteria from proliferating or becoming more in nature so that our bodies can naturally defend against them, or they kill bacteria. They are not designed to treat viruses. They're not designed to help with allergies.
What are they best for when you're treating illnesses?
Best for like bladder infections, skin infections, pneumonia, sinusitis that goes on for a period of time greater than 2 weeks, a complicated bronchitis where you're coughing for a long period of time and you can't clear it on your own, as well as some other illnesses.
So still a lot of illnesses that are certainly prevalent in the fall and winter months.
Oh, definitely, definitely. But I think that sometimes we're too quick to use antibiotics, thinking that I've had a symptom for 1 or 2 days and I know I'm not going to get better, and people want to use it right away, and that's not the right time to use it.
So you're feeling sick, you're thinking you want to reach for the antibiotics or go see your doctor to get prescribed antibiotics. What should you do?
You should first see, do you have fever? How long your symptoms have been? Have you taken anything over the counter to see if you can help with your symptoms? If none of that seems to work, then you go and see your doctor. And also listen to your doctor. If your doctor tells you that antibiotics are not indicated at this time, then don't take them. Don't pressure your doctor to try to get them. The problem with taking too much antibiotics are we're breeding resistant bacteria that are very difficult to treat.
That's interesting because bacteria have kind of evolved, I guess, over time.
Correct.
To fend themselves off from antibiotics.
Correct, because people take it at inappropriate times when they don't have a bacterial infection. So we all have bacteria in our body. It learns from the antibiotics that were used and it becomes resistant to it. Or they don't take the complete amount of antibiotics, so you never really get rid of all the bad ones that were there, and they learn then, and they become resistant as well.
Get super bacteria.
That's correct.
And they're not necessarily great for viruses. Give us an example.
They are not good for viruses at all. The common cold and the flu. Viral gastroenteritis, when you have this nausea, vomiting, diarrhea, that's not a bacterial cause. They don't work for that as well. There are other types of gastroenteritis that they are good for, but not those things.
Always trust your doctor. Antibiotics not always the best option.
That's correct.
All right. Thank you so much for being with us this morning.
Thank you for having me.
All right.